My name is Dr. Patrick O'Byrne. I'm a general dental practitioner based in Ireland, Galway, Ireland. I see a broad range of patients, children, adults. I'm 20 years a dentist, almost 20 years. I'm married to Kira and we have two children, Patrick Jr. and Elizabeth, 11 and 8 years of age. So, pretty busy guy. I'll be very honest with this answer because a number of my friends and colleagues have asked me about this. You need to sit down with your partner and have a chat about how you're going to do it, because otherwise there's going to be conflict. My wife tells me I'm studying 40 hours a week, but in reality I'm not. But what I did was we sat down after the first few weeks and said, we've got to get a proper schedule going here. So we have a schedule for my study, my work, my wife's work, and family time. We stick to that. We really do. We make a deliberate effort not to allow things get out of control and overlap. It can vary anything from 20 hours to 40 hours a week, depending on what my assignments are like. I know some of my colleagues put even more in, but I think realistically that the program has been tailored for people who work, and they realize we can't put crazy hours in. They know what we cannot do. So it's entirely up to yourself, but it's very achievable to do well in the program with relatively modest number of hours, as long as you work hard during those hours. I think the favorite aspect of doing the online program was accessibility. You can watch the lectures when you want. Early morning, if you're up, nice, quiet house, kids not up yet, that sort of thing. Also, again, it's accessibility. It's library access. It's journal access. It's been so much easier than when I was an undergraduate in the early 2000s, where you were up with, I suppose, lectures at all hours, and if you missed a lecture, you were in trouble. Technology and accessibility has obviously come on in leaps and bounds since I was an undergraduate student, and it's so much easier. There's no excuses. I'm 20 years in dentistry. I was kind of getting a little bored with general dentistry. That's why one of the reasons I decided to branch out. But even now, I haven't graduated yet, but locally, a maxillofacial surgeon, a consultant, heard I was doing the program in Ostro and offered me a place in his practice to come work with him, which is amazing. He couldn't believe it because it's such a niche area. So I've got a job before I even graduate, but even in my own general practice, I'm seeing a lot more orofacial pain patients, and a lot of that is down to word of mouth, and then also the fact that I'm spotting more conditions because of the knowledge I have. So it's been hugely beneficial and motivational, and yeah, it's really reignited my love of dentistry, and I haven't graduated yet, so that's not bad. Again, it's just down to lateral thinking outside the box. We're seeing issues now that I wouldn't have spotted in the past. It's not that they're rare cases, it's just issues like bruxism, clenching, grinding, and triggering headaches and small things. I'm no longer confined to looking at teeth. I'm looking at airways, I'm looking at fetal structure, muscle problems, I'm looking at the holistic package, and that's made my career so much more interesting as a result.